I'm here to talk today. I'm Julie. I'm here to talk today about our second hazardous drug trial that we're doing on ICC. I want to say thank you, first of all, for letting us do an initial trial and then coming back for a second trial. We appreciate your hard work and your input in trying to get hazardous drugs ready to go house-wide. So with the second trial, we wanted to do a video just to cover some key points and some key differences that we're going to try this time around. First off, the trial dates are going to be May 13th through May 27th. So starting this coming Monday and going for 2 weeks. With that, the key points we're going to look at this time are signs. So we updated the signs, and with it, we're going to hang these on command hooks outside the door if they are on a hazardous medication. So with the sign, we added some verbiage about using special precautions when handling body fluids. That was one piece we missed the last time, I think, when we had just the orange triangles. Nobody knew what they meant. So we're trying this a little bit different. So the nursing aides will also understand that if a patient is on a hazardous drug, they have to take precautions when they're handling the body fluids of those patients as well. So that's one of the big things we're redoing. Also, after you clean somebody up that's had a hazardous drug in their system, you need to wash your hands with soap and water instead of using the foaming hand sanitizer. So just remember, wash hands with soap and water. The second big difference that you're going to see with this trial is the location of our chemo gowns that we use. So in the first trial, we had the little black rolling bin outside the door. This time what we're doing, we're going to be putting chemo gowns behind each box of gloves in the room. So we're hoping that's a visual cue that if the patient's on a hazardous drug and you have to clean them up or change their linen or empty a commode, or you remember to grab the gown as well as the gloves when you're doing those activities. We are asking that the nurse aides replace those gowns, those chemo gowns, after they use one. We're going to relocate some of the chemo gowns from the medroom into the clean supply room, so you will be able to find those there. The other thing, just as a reminder, when you're cleaning a patient up that has had a hazardous drug, you also need to wear 2 pairs of gloves in addition to the chemo gown, and that's just a measure to protect yourself. After you've finished cleaning the patient up, then you can take off the PPE and throw it away in the regular trash. It doesn't have to go in any special bin, it can just go in the regular trash. The third big thing that we're going to see is that the medication administration process is going to be a bit different. We're trialing something different. So we're asking that the nurses wear gloves with every single med pass, not just patients that are on hazardous drugs. This is just to hopefully help if we don't know they're on a hazardous drug, or if the door's not marked, we're still offering a form of protection by wearing the gloves when administering medications. After medication administration, if it is with an intact tablet or capsule that's a hazardous drug, you can just take the pill packaging and the gloves. Those both go in the regular trash. There's no special trash can or bin that we need to throw those in. The only exception is Coumadin, which still has to go in the black bin because it's environmentally harmful. The other thing we're going to try, and then wash your hands with soap and water after administering the hazardous drug. The other thing we're trialing this time around is a hazardous medication cart. All right, so we borrowed these carts from pharmacy, and what we're going to do with these are going to be just for medications that need to be crushed. So if you have a patient on a hazardous drug and it needs to be crushed, we want you to bring the cart in. All right, so what you'll find in the cart is on top you're going to find your RX Crush, and then the code for this is 1234. We did label that for you so you don't have to remember it. RX Crush supplies are going to be in the top drawer, and then hemogowns will be in the drawer below it. All right, and so if we open it up here, you'll see inside we have Chuck's pads. So what we'd like you to do is take a Chuck's pad, place it on the top of the cart, okay, and then you can grab your supplies that you'll need. The only thing we're not including on the cart is sterile water, because we don't want that to be used between patients. So you have what you need right there. And then your chemo gowns are below, okay? And then you just use the gloves that are in the room. We don't have any special chemo gowns that we would use. So I'm not going to go through the whole process, but we do have a standard work, so we want you to follow your standard work when crushing medications that are hazardous. The only thing that's not on the cart that I want to tell you is that we are going to have a black bin attached to the side of the cart, and what we want disposed of in that black bin is the actual supplies that have been contaminated with the crushed hazardous drug. So specifically, we're looking at probably these 3 supplies, okay, for going in the black bin. All right, everything else can go in the trash. And if the Chuck's pad became soaked, we'd also want that to go in the black bin as well. All right. So that's something that is pretty new, and we would want a lot of input on that. If you guys can give us that, that would be great. The cart is going to be kept in the med room by where we have the hazardous drug supplies right now. The 4th thing that we're going to focus on is we're changing up the education a little bit. So we're going to put an S-bar in the huddle books. So you'll start seeing that tomorrow morning, or tonight, hopefully at tonight's huddle. We also have key points, and we're going to be posting these in the bathrooms, in the break rooms, in the med rooms. So you'll have some information that's there and readily available for you. The 3rd piece of education we have is the flyer. Now these you might not see towards the end of the week. We're still kind of getting this one perfected, but you'll see this as well. So it kind of goes over why we're doing this, what some of the terminology means, and what the most common meds we saw during the first trial, and what the risk of exposure is. And then some tips on handling. And then we'll have more information about what to do if you're exposed, and spill kits. We're just kind of working to finalize that with some of our other departments. We also would love feedback. So you'll find when we have these posted, both Marcy and mine's cell phone number are listed here. And we would love for you to text us with whatever feedback you have, good or bad. We need it all so we can really perfect this thing to make it go house-wide. And I think that is it. Thank you again.